Good afternoon or good morning, depending on where you're watching from. You are watching Health News Now with Doc and Dean. I want to thank you all for joining us here on another Friday. And we want to make sure before we get started on today's hot news topics, health news topics, want to make sure that you let us know where you're watching from. So you put that in the comments. Make sure you put in the comments where you're watching from. We'd like to see where you're watching from all over the world. Also, if you like what you're seeing, make sure you share it with a friend. Let a friend know that, hey, you're watching Health News Now with Dr. Dean. So you can get the latest health news each and every week here on blackdoctor.org. And finally, if you have a question or a comment, or you have a topic that you'd like for us to cover here on Health News Now, please drop that in the comment section because we want to answer your health questions here on blackdoctor.org. So I think we've got all the particulars out. So, Doc, how you doing?
Good, good. I almost didn't recognize you with your new look. I wasn't ready.
I'm trying to keep it clean. I'm trying to keep it clean for just 2022. We go clean in 2022.
Well, you've succeeded. I think the first thing we should continue to talk about the COVID virus, the Omicron invasion of our communities and our country. It looks like it's peaked in some parts of the country. It's certainly looked like it's peaked here in California. And what I did notice about it was that it didn't seem to have the same clinical impact that the Delta virus has. Now, that Delta virus is still around for some people, and we can't always distinguish, but it does look like my calls have gone from 100 a week to about 30 or 40 a week. And I have a sense that most of the people are not as sick. And so I reached out to Dr. Oliver Brooks for a couple of answers. One is why are vaccinated people still having difficulty with this virus? And we noticed that at the beginning of December, African Americans were pretty much on par with getting vaccinations. But by the end of December, they were twice as likely to be hospitalized and twice as likely to die. So let's see what Dr. Oliver Brooks has to say about that. Let's welcome Dr. Oliver Brooks to the Doc and Dean Show. And we just looked at an article that talks about the Omicron variants surging across the country. African Americans had better numbers in terms of hospitalizations and deaths beginning of December, but were twice as likely to be hospitalized at the end of December. First of all, tell us why the Omicron variant is so infectious.
Well, the virus is 2 to 4 times more infectious than the other current variant, which was Delta. It has more mutations on its outside, so it can evade the body's immune system. So even if you're vaccinated, it can bypass that sentry, if you will, those immune globulins, your antibodies, or your T cells, and get into your body and start an infection.
You know, one of the enigmas, though, is that for vaccinated people, even though the virus is more infectious, they don't get hospitalized as often, and they don't die as often if you're vaccinated, and especially if you're boosted. What's going on there?
So if you're vaccinated and boosted, 10 times less likely to get infected, 24 times less likely to be hospitalized. So what happens is the booster, the extra vaccine that you were given, increases your antibody levels. And that's part of the solution, part of the benefit. But there are two things that fight infection in your body. The antibodies that we all hear about, but there are also these cells called T cells. Basically, they're part of the immune system. They see something that they don't like, that they're trained to not like a virus, and attack it. So we get a very robust T cell response from the booster, and that is really what is leading toward and causing or helping to block those that get infected from being hospitalized or dying. So getting that booster is crucially important, getting vaccinated even more so.
Well, why do you think African Americans have lost that juice? I mean, at the beginning of December, our numbers were pretty much close to Caucasians in terms of hospitalizations and death. Now we're twice as likely to be hospitalized and almost as likely to die.
Right. So what I really believe is it started with after the December studies or measures, we had the holidays. And then here we are in January. African Americans have lower rates of vaccination. Think there is also some fatigue. People are just not wearing their masks as often. And then we have underlying conditions, which is probably one of the other major factor after the low vaccination rate. We're less than 50% fully vaccinated, and I think somewhere around 30% boosted, which is very low. We have diabetes, we have hypertension, we have obesity, of chronic kidney disease, chronic lung disease, immunosuppression from other conditions like lupus. All of those things put you at higher risk for hospitalization and death if you do acquire COVID-19. So it's just speaking to the basic fact: get vaccinated and take care of your health. There was one other thing I would add. As it was in the beginning, mid 2020, when the pandemic was really digging in, we're more likely to have jobs where we're exposed. We're less likely to have access to good health care. We don't have a primary care physician. So live in housing where we're all on top of each other. So all these things are leading to higher rates of infection, hospitalization, and death.
But we were getting there. We were getting there, and let's just hope that the message gets through to get that with all of the evidence we have. What are they waiting for? So get vaccinated. If you're vaccinated, get boosted, and get your children vaccinated. So, Dr. Oliver Brooks, thank you very much for joining us on this segment, explaining to our audience on Doc and Dean. Yeah, so here's same problem, certainly the underlying social determinants. He talked about all the things we don't have and all the things we can't do. But one thing we can do is to read and study and listen and make good decisions based upon fact. There was one study that I wanted to discuss with you, Mr. Dean, and I'd be interested in your perspective on that. Yesterday, the news was filled with an announcement from the World Heart Association that any alcohol is not good for the heart. Now, any alcohol is not good for the heart. And this is an example of something that was released without proper documentation. I mean, I looked at, I was real interested in this because, I'm getting up there, man, I want to do everything I can to keep my heart moving in the right direction. But this study the studies upon which they made that pronouncement were really very shoddy in some ways. Now drinking alcohol has a lot of negative effects on certainly people in our community with heart disease, diabetes, aortic aneurysm, stroke. They have a higher incidence. Cirrhosis. Well, now we're talking about the serious stuff. Talking about we're talking about alcoholism. And I think that we can't minimize the impact of alcohol in our community when we start looking at those things. Pregnant women and people who drive should never drink alcohol. But I just don't think that me sitting in my home at the end of a hard day with a glass of red wine is a big problem, because they've been telling me for the last several years that 2 glasses of red wine improves your health. What say you, sir?
I would say that in the macro sense, this is why people are really distrustful of medical research, because it can become confusing. Because you're right, for so many years, we have learned that red wine is good for the heart. A glass or 2, no more than 2 glasses per night for men, 1 glass for women is fine in terms of it being good for the heart. Now we get this research that says without context. And then that's the crux of it, is that when we get these reports and when we get these news stories, they tell you the highlights, but they don't give you the context. And when we're talking about, and the same thing applies to COVID, and we're looking at the research, how many people are included in the study? How long were the studies? So you've got to ask some questions before you could just take it at the results that they're reporting, because the results are designed to get people to pay attention. And the way they present those results is going to get, if you say, hey, alcohol is bad for the heart, any alcohol is bad for the heart, guess what? There's going to be a lot of people that pay attention, but a lot of those same people aren't going to ask the questions that I just asked about the study. And that's where it can become dangerous with regards to how they're presenting the results. So I think we have to be careful. We have to ask some questions, and we have to have a healthy sense of skepticism when we see these types of stories.
Yeah, I think that's one of the reasons for the Doc and Dean show, for all the
Mhm.
stuff we do on blackdoctor.org, and for what we do with the African American Wellness Project and the Wellness Watch. We try to bring you the context. We try to select those things that might impact the African American community the most,
Mhm.
and give you what we think about. But this is something very close to my heart. I mean, if in fact you lose a few minutes of life, so to have those 2 glasses of wine or one and a half in the evening, well, I'm sorry, I'm gone. I mean, whatever my destiny, it's going to arrive. But to be perfectly candid, there are some serious problems in our community with alcohol, no
Yes.
question about it, and we need to be vigilant about that. But at the same time, I don't think a glass an evening or a sip of a cocktail here and there is really going to have a big impact on your cardiac health.
I want to give a couple of shout outs here to Agnes and Sherry and people that are watching from all over. We've got folks from Nashville, New Jersey, New York, Louisiana. So just want to give you all a shout out. Thank you all for watching us and again, supporting Black Doctor, the African American Wellness Project, and Health News Now with Doc and Dean. So thank you all. And hopefully we'll get you some news that you can go back and tell your friends and say, hey, look, when you hear that story, don't pay attention to it because I watched Doc and Dean and they said you can drink your wine. Now, on a more serious note, you're absolutely right. Alcohol abuse and use is very significant in our community, and it has a disproportionate impact on our community. So we do have to be careful and with alcohol use, but we cannot just look at these stories at face value and run around waving it and saying, "Hey, you need to stop drinking altogether."
Let me just give you a quick anecdote. When I was going through the literature this week, I saw a study from an open source thing that said that that anxiety and depression were half as bad for African Americans during the pandemic as for others. And I said to myself, you're going to take a pandemic, pile it on all the other stuff we have to deal with, racism and prejudice and discrimination, and tell me that we're going to do better. I just think those are the kind of stories.
Well, I think some of that stuff is, I do believe a little bit of that because we have less exposure. When we're home more often, when we're spending times with the people that we trust, and we're not exposing ourselves to a lot of the micro and sometimes macro aggressions that can happen in a workplace, that can happen in society, all of those things. When we reduce that, I think our anxiety goes down. I think for Black people, and say the fewer interactions we have and potential racism interactions that we have, I think, hey, that's going to reduce our anxiety.
I may have an old school perspective on this, but if you're driving a bus, working in a nursing home, you find out that Black people are dying more often from this problem. I just don't see how we could be any more or less calm than we were before this all started. You got, I talk to families, and you got, mothers and fathers cooped up in the house with 3 or 4 children, running around all day long, constantly. I just, it's hard for me to see that, but I don't want to dwell on that. We're talking news here. One of the things that disappointed me when I read it this week, was the incidence of cervical cancer among African American women. Mm-hmm. I had no idea, and maybe because you're probably much closer to these contemporary topics, that African American women are 1.5 times more likely to die from cervical cancer. And after the age of 70, they're 3 times more likely to die from cervical cancer. Now, I know there are institutional racism and all these other social determinants, but I really wanted to talk with an expert about why this statistic still at this particular point in time. So I called on my friend, Dr. Albert Brooks, who's one of the most distinguished obstetrician and gynecologists in the Bay Area, and asked him to give us some information about cervical cancer in women and why these statistics for Black women.
An age-old problem of getting screened for various conditions. And it's been shown that African American women don't get screened as often by their physicians for sexually transmitted diseases. And we've looked at multiple populations in the past in several studies. And we know that screening is the most important way to detect cervical cancer and to prevent it by certain practices, use of condoms, etc. But the most important thing is to get screened early. And once teenagers become sexually active, in my practice, we screen them for cervical cancer, and we were able to pick it up very, very early when I was in practice. So I think that's one of the reasons African American women are have such high statistics when it comes to cervical cancer.
How does cervical cancer present? So why would a woman know to even think about cervical cancer?
She wouldn't have any symptoms. She wouldn't feel any particular abnormality in her genital organs. It requires a speculum exam by a gynecologist looking, or a nurse practitioner and or physician's assistant needs to do a pelvic exam and both visualize the cervix, which is at the top of the vagina when you look in, and look for signs of cervical cancer, and obtain a pap smear. And if the pap smear shows dysplastic cells that aren't growing normally, it will require further investigation, including what's called a colposcopy. And that's looking uh, at the cervix and looking for certain areas that are discolored, and you then can take a biopsy of those and diagnose either dysplasia or cervical cancer.
All right, tell us about how important the papilloma vaccine is to preventing cervical cancer.
Yeah, the vaccine is called Gardasil, and it's extremely important. There have been ongoing studies since the early 2000s showing lower rates in patients, women who've received the vaccine Gardasil. And the study has to do with close to um, 16,000 women over about a 5-year period, and they had the Gardasil treatments, and their cancer rate that's currently being looked at is extremely low, lower than other populations. So we know that it works. We know from large numbers of studies that have replicated that it lowers the risk of cervical cancer.
Are African American young women getting this vaccine as often as other groups of women?
No, they are not. We've shown it. There've been many studies, several studies, I should say, that show lower rates of screening. I'm sorry, lower rates of the administration of Gardasil to the African American populations, and it has to do again with the care that providers are offering women in regard to this, and they have to explain to them that there's a series of shots, and it has changed over time as to the number of of um, what's covered by the Gardasil. And there's something called a quadrivalent, or 4 types, and now it's up to almost 9 types of this virus. Just like we've talked about Omicron and Delta when it comes to COVID, there are multiple types of the human papilloma virus, and the vaccine has to cover that. And even with the early vaccination that Gardasil was used back in 2006, which only covered 1 or 2 types of the virus, now the current one covers 9 types. So it's very effective, and it'll prevent, but it requires the health professional to sit down and explain how the Gardasil works, explain why the vaccine has been recommended, and then I think we can turn this around. But it takes an effort, especially if you have your own physician. You want to have a conversation with the physician about cervical cancer, and he or she should be having that conversation with you and offer you the vaccination.
Yeah, see, I think that here again, it's one of those situations where we have to know our statistics. and we have to insist on the screening studies that keep us healthy. Dr. Albert Brooks, let me thank you for joining this week's edition of Doc and Dean. Our young superheroes protect us. Now let's protect them. I'm Dr. Mike Lenore. Bring back the power of the Black Panther and all superheroes to our kids. Protect them from getting COVID by getting them fully vaccinated. Protect your superhero so they can continue to protect us. Sponsored by the African American Wellness Project and the Alameda Alliance for Health. We're all in this together. Well, so thanks to Dr. Brooks, and obviously we got to slide that message in there about vaccinations, and we're going to be here long after other people are gone. Mr. Dean, we're going to be talking back, once everything kind of calms down and people start to forget and start going out like they should and gathering, we'll still be talking about what's going on with COVID, and we'll still be talking about vaccinations. But I understand you were involved in a very important conference this week, and you tell us a little bit about that and what came out of it.
Well, we did our inaugural State of Black Health on Monday, on Martin Luther King holiday, here on blackdoctor.org. We did it in conjunction with the Rodham Institute at George Washington University. And we had 5 virtual panels featuring experts from all over the country talking about issues that are disproportionately impacting African Americans. And so we had of course, we had to have a COVID panel. And then we had a panel on breast cancer. We had a panel on heart health. We had a panel on obesity and eating and exercise. And then we also had a panel on mental health. And so we really had some wonderful partnerships with organizations like the Association of Black Cardiologists, the National Medical Association, Black Coalition Against COVID, and many others that provided panelists. And we had some patients come on and talk about their experiences, and really was a worthwhile event. We reached over 400,000 people with all of those panels. And we're planning to do another one during my Minority Health Month this April. So we really want to emphasize with these large summits, all of those major issues that are impacting Black Americans. And so, Dr. Lenore, we've got you teed up for the next one, because we're going to be talking about respiratory health, asthma, and COPD. So we know that's in your wheelhouse. So we expect you to be part of one of those panels this coming April.
What was the most surprising thing you learned during these panels? Because you probably are as knowledgeable as most of these people now about most of these illnesses. You've been talking to us all year long and in these various panels. Well, what surprised you the most?
One thing that didn't surprise me, but one thing I did get some clarification on was when we had our discussion about quarantine versus isolation. And when that came up, I laughed to myself. I said, well, we talked about that here on Doc and Dean. And I think it was Dr. Clark that said that quarantine is when you've been exposed, but you don't know if you're positive. You don't know your status yet. So you quarantine. If you have been exposed and you know you're positive, that's when you isolate. And so I thought that was really, really good, because you did a great job of stopping me and saying, wait a minute, they're not the same thing. And I did kind of get that final definition on that. The other thing I thought that was really, really interesting.
The one thing we said, though, that the CDC agrees with, or I agree with the CDC or whatever, is that if you have had COVID within 90 days, you really don't have to quarantine. I mean, it was some interesting stuff. I don't know where they talked about it. I just read a large study from England that said that people who actually have COVID have just as high antibody response as when you get the injection. A little bit more for the injection, but not statistically so. Unvaccinated people obviously have a different problem. So getting COVID, it does give you some antibodies. Yes. But the most effective thing is to get COVID and then get boosted or get vaccinated. Right. And then you have even more response. But people who are infected within 90 days probably don't have to quarantine, according to the CDC. But anyway, I just wanted the people to know.
Yeah, and I
You're
think
getting more stuff here than you get in them big panels.
yeah, well, we get the same stuff, and I think one of the things that was really good is that when we did the heart health panel, we had a patient, we had a Black female that had both a heart attack and a stroke.
Oh, wow.
And she talked about one of the things that we've talked about here on Wellness Watch and as well as on Doc and Dean with Dr. Glenda, and that is being your own best health advocate. Because she had her heart attack, she was going into her doctor telling her doctor about her symptoms, and the doctor was sending her home saying it was stress, it was anxiety, and wasn't really running the test to make sure that everything was fine. And so eventually when she had a heart attack, she was on a treadmill running, and she had a heart attack. And the doctor still didn't run any more tests after they treated her for the heart attack. And then she had her stroke. And that's when she realized her husband had to step in and push harder for them to run some significant tests and realize that and then she realized she had a family history of heart disease. And so I think that her telling her story was a cautionary tale, one about being your own best health advocate. So Patrick, you're absolutely right. We have to speak and we have to push. If we know our bodies better than anybody else. And so if you're not feeling right, you need to make sure. And if that doctor's not telling you what you want to hear, find another one. The second thing is the importance of a family history, because if she had that family history and she knew that family history going in, that doctor may have, won't say 100%, but that doctor may have run those tests because they know, hey, she's got a family history of heart disease and heart illnesses. And so therefore, there could be a good chance that this is something more significant than just stress or anxiety related.
You know, what most people don't realize is that when we talk about the impact of discrimination, unconscious bias, all of the things that we as African Americans face, women are always in that category.
Yes.
And certainly Black women generally receive some of the worst health care in the country. And unfortunately, they're smart enough to understand that maybe better than we do as Black men. But it is interesting that when we start talking about going into the emergency room with cardiac symptoms,
Right.
you know, women are the ones that are most often misdiagnosed, and ultimately they pay the price.
Right.
So it's good to continuously point that out. When you talked about mental health, what were some of the interesting things about that?
I think the key for our mental health panel was, with two key points. One, as part of every African American's mental health makeup is what we call PTSD, and that's post-traumatic slave disorder. And that means we have a shared history of enslavement in this country and treatment as a result of that enslavement that is part of every African American's psyche. The second thing we would say is that as a result of that, we have elevated areas of paranoia. We have this distinction, especially for Black women, of being kind of this strong Black woman and just taking on everything and not sharing, not letting people know that we need some help, that we're struggling, that we're having some mental issues, because we have this, don't share too much of your weaknesses because that will be used against you. And that is part of that kind of enslavement, post-traumatic slave disorder history that we have here in this country. And so when we're talking about Black mental health, the other piece is our faith, right? And so for many Black Americans, we can't dissect our faith from mental health. We have to kind of connect the two. And so if we're going to talk about Black mental health, we have to include our faith. We have to include PTSD, that post-traumatic slave disorder, as well as what is happening here currently in this country as part of our stressors, instead of just saying, oh, you're overreacting, because that is the quickest way to get someone not to seek the help that they need.
Well, it seems like our time has gone by so quickly. We may have to extend Doc and Dean. We got too much news. So instead of my signing off with my usual, flair, I'll just play this one last video, and then we want to thank you for joining us, and we'll see you next week. But let's play that last video just so to remind people where we're coming from.
Has really been changed by the COVID-19 pandemic. I know that you are tired of social distancing and wearing masks, and you want to gather with family and friends. But you know who isn't tired? Coronavirus. Get vaccinated, please. This message is sponsored by the African American Wellness Project and the Alameda Alliance for Health.
Yeah, well, you know, the coronavirus is not tired.
Nope.
But anyway, thank you very much for joining us. Remember, health is your biggest asset. We'll talk again next week.